Matt, Anna, come on up. We have a few minutes for questions. Are there questions from the audience?
Steve Ash again. Very nice talks, really informative and well planned. And it is really true that we need to talk to and listen to our patients. I think that's really important. One of my partners in nephrology joked one day, he said, medicine would be a great career if it wasn't for all these sick people. But the focus of doctors tends to be on what we think we can fix, not what the patient's most primary concern is. And that's the reason that the doctor would focus on phosphate levels instead of how am I going to fix tiredness, energy, and all of the things that go along with hemodialysis. My first real job as a nephrologist was actually not in Indiana, but at the University of Utah. I drove from Indiana to Utah to spend 3 months working with Kolf on his wearable artificial kidney, the WAC. And I also was a staff nephrologist at the university. The WAC was not quite what I thought. It was wearable, portable, but only when it had charcoal as the main sorbent. It didn't have a complete sorbent system like in the ready column. And so there were patients that did enjoy backpacking, carrying it around. But what I did see would have been a wonderful machine as a bedside nighttime dialysis machine. Single access, sorbent-based, battery-powered, and with a complete sorbent system would be a very nice nighttime dialysis system on a bedstand, maybe every other night. So that's, in fact, what I and a team of engineers developed by the 1980s. My question is, if any of you have ever asked the patients to compare a nighttime portable, highly portable, safe artificial kidney to a wearable kidney that'd be worn presumably during the day with equal safety. Between the two, which would the patients prefer?
Dawn, you answer?
Personally, I would prefer something safe that is not wearable. That's just not aesthetically pleasing to me. And I'm a fashionista, and I'm a very activated patient, and I can't imagine walking around the streets of New York with a dialysis device on me. However, something that I can do at night that is really portable so that I can travel to places like this from New York and do my dialysis treatments while I sleep at night would be optimal for me. I've jumped right on it.
Thank you. Anyone from the committee?
I really appreciate what you said. One of the things we've learned, I'm glad to hear Dawn's voice, is, one of the things we've learned through a lot of discussion with patients, and I can turn to the panel as well, is that there's not one solution for everyone. That the variety of our patients has to be respected because of their preferences, whether being a fashionista, which Dawn is absolutely a fashionista, or whether you have access to care partners. It's going to make an enormous difference socioeconomically, culturally, whether you're working or not, all going to make a difference, and there is not going to be one size that fits all. And I think that's one of the things that I learned from talking to Matt and Brigitte about, patient activation and patient preferences. You're not going to solve this with one fix, we don't think. Any other questions? Let's thank our panel, please.